Yeah, so as they say that vision is always more important than eyesight. So that's why that's what Dr. Indu, I think, emphasized, that we should have a broader vision rather than just looking at the picture. Next we have Dr. Sivani Kodali Bilateral MVG in CRAO with antiphospholipid antibody syndrome.
So, good evening, everyone. So, I am Dr. Sivani. So, these are my abbreviations. And coming to the case, a 60 years old female who hailed from Visakhapatnam came to us on 25th July 2022 with chief complaints of right eye pain, blurring of vision, redness and watering since one day. Who was diagnosed elsewhere outside as right eye CRAO and was started on Timolate Maliate and was advised systemic investigations, but the patient didn't undergo any systemic investigations there. Where family and systemic history is not nil significant. When she came to our OPD, she presented with in the right eye unaided visual acuity CF 1 meters, and there is neovascularization of the iris with pupil mid-dilated and sluggish reaction. And intraocular pressure in the right eye is 40 millimeters of mercury, and when gonio is done after giving IV mannitol, it appears to be open angles, whereas left eye is normal. So on fundus evaluation, you could see that there is macular whitening with cherry red spot and pale optic disc, whereas left eye optic disc is fine. So with these findings, we came to a provisional diagnosis of both eye pseudophakia, right eye central artery occlusion with neovascular glaucoma in opal angle stage. And we augmented agents in the right eye and started on brimonidine and timolate maliate combination along with dorzolamide. And we advised the patient for intraocular Avastin, but the patient denied at that visit. And later, after 2 days, the patient came to our OPD with severe pain, and at that time she underwent right eye TSCPC with IOA. So after 3 weeks of TSCPC and IOA, her vision improved to 2400 with intraocular pressure came to 14 in the right eye. So after that, her intraocular pressures came to normal. Again, in January 27, 2023, she came with the similar complaints in the other eye also with unaided distant visual acuity with HM in the left eye with intraocular pressure 34 millimeters of mercury. So this is the right eye fundus photo, and in the left eye again the patient had pale optic disc, macular widening and cherry red spot. So again we started AGMs in the left eye and continued the AGMs in the right eye and did left eye paracentesis and massage and was advised left eye intraocular Avastin. So now we have a doubt what could be the cause for this bilateral sequential CRAO with NVG in this patient. So we advise the patient the systemic investigations where anticardiolipin IgG antibody came to be positive, and we referred the patient to rheumatologist where he started the patient on warfarin hydroxychloroquine. So what is antiphospholipid antibody syndrome? It is a systemic autoimmune disease which can affect both arterial and venous thrombosis, and fetal losses and thrombocytopenia can happen. So it usually affects 15 to 50 years age, and women are more commonly involved. It could be both primary or secondary, where secondary can be involved with SLE. Ocular findings are usually seen in 15 to 88%, and these clinical manifestations can have a wide spectrum, which could be from asymptomatic up to catastrophic ABS characterized by multi-organ failure also. So these are the some of the manifestations of anterior segment. Posterior segment, most commonly it could be associated with venous occlusion, but in this case it is associated with arterial occlusions, and these are some neuro-ophthalmologic things. So this is a very rare case entity. When I went and searched for the literature, I could find only one case report from the Delhi Journal of Ophthalmology where a small child of 15 years old has been involved. So after that, the patient's intraocular pressure is fine, and her vision is also good. So this is so I just wanted to highlight the thing that even in the elder age group also antiphospholipid antibody syndrome can be positive not only in childhood cases.
Thank you. Do you think the problem in the left eye, catastrophic problem in the left eye, could have been prevented?
Could have been prevented, but even if we have advised investigation, patient didn't underwent any of the
Did you advise? Because you did not say you advised.
We advised, but the patient did
not get it done.